Good morning, everyone. A warm welcome to all participants from Malaysia, the SEAMEO network, and affiliated countries to the IMR-SEAMEO webinar series 2022. My name is Dr. Hans Prakash Sadasivam from the Institute for Medical Research, and I will be your moderator for today's session. Ladies and gentlemen, this webinar series was initiated with the aim to share knowledge and discuss topics pertaining to biomedical research. Before we begin our presentation, allow me to announce a few housekeeping messages from the Secretariat. We will not be taking questions during the presentation, but participants may post their questions using the link that has been shared in the invitation email as well as the YouTube channel. The question and answer session will be conducted at the end of the second presentation. The attendance link is also provided for those who would like to receive an e-certificate of attendance. You may also find the link in the chat box of the YouTube channel. Ladies and gentlemen, the theme for today's session is the Ministry of Health Biobank. And our speakers today are from the Institute for Medical Research in Malaysia. Although biobanking has been around for decades, there is a lack of awareness and understanding regarding biobanks and biobanking. Biobanking has developed from basic biological sample and data storage to a dynamic and sophisticated entity that are part of a larger infrastructure and networks, such as the BBMRI and Pan-European Biobanking. Research in biomedical sciences is many a times based on the analysis of samples, and these samples are usually needed in large quantities for meaningful and impactful studies. As such, if there are more high-quality, well-characterized samples available through biobanks, medical research and biomedical research will advance at a faster pace, resulting in better delivery of precision healthcare, which is part of the United Nations Sustainable Development Goal 3 regarding good health and well-being. For today's webinar, we have two speakers. Our first speaker is Alia Aina binti Haji Anuar, who is a science officer with the Biobank unit of Institute for Medical Research. She received her biomedical science degree from the University Islam Antarabangsa Malaysia, or UIA, and has been involved with biobanking for more than 5 years. She is currently working at the National Institutes of Health, and her research interests are in biobanking and oncology. For today, Alia will be providing us with an introduction and overview of the Ministry of Health Biobank. Alia, the screen is yours.
All right. Thank you, Mr. Moderator, for the kind introduction. Assalamualaikum and a very good morning. Hello, everyone. My name is Alia. And first of all, I want to say thank you for giving me the opportunity to present my topics today entitled Introduction to MOH Biobank. All right, so without further ado, let's start with the presentation for today. Okay, so this is my presentation outline for today. In the beginning, I will talk about the definition of MOH Biobank. And then after that, we will move on to the importance of biobank. And then after that, I'm going to talk a little bit of the background of MOH Biobank. And then we will talk about the point that may be interest to the researchers, which what are the services that we provide, and also how the researchers going to access the biospecimens in MOH Biobank. All right, let's move on to the next slide. Okay, so the definition of biobank. What is biobank and what does it do? Biobank actually covered the collection of plant, animal, and also human specimens. For the purpose of this presentation, I will focus on and also elaborate more on human biobank. So human biobank is actually a collection of human biospecimens and their associated data. And biobank, also referred as biorepository or repository, or also we call it tissue bank. So it means that biobank actually a place that to store a collection of many types of biospecimens. For example, blood, tissue, saliva, what else? Urine, and other types of biospecimens for research purpose. Research such as genomics, proteomics, personalized medicine, and many more. Okay, so this all the process to store, to collect, to archive, and also all the activities that related to biobank, we call it biobanking. Okay, so as you may know, we have many types of biobank. If you look at the right side of my slide, I listed several biobanks that are well known in the world. Firstly, we have Biobank Graz, located in Austria. This biobank actually is one of the well-known clinical biobank in the world. This biobank consists of, they have around 20 millions of individual specimens, consists of fluid specimens, individual samples, consists of uh, fluid specimens and also tissue specimens. And then we also have UK Biobank, which concentrate on a population-based biobank. And then also we have China Kaduri Biobank. So this biobank actually concentrate on genetic and environmental causes chronic common disease among Chinese population. And lastly, we have Euro Biobank. So this biobank actually focus on collecting specimens that associated with rare diseases. So from this, you can see that there are many several types of biobank. Depends on what the country and the people needs. And as science advance, the type of collection may be changed according to what the researchers and the people need during those time for their study to help the people and also the country. Right, so let's move on to another slide. Okay, so why biobank is very important? Okay, so first of all, the biobank is very important is because they can support and promote biomedical research. By support and promote, it means that biobank can provide resources, specimens, and related data to researchers to conduct research. For instance, for example, that the researchers, they do not need to go to the hospitals to engage with clinicians to find the target patients that they want. Instead of doing so, they can go to biobank and then request all the specimens that they needed for the research. And furthermore, by doing this, biobank already help them to save the problem in progressing of for them to collect the samples and then see the patients. So biobank already help them from that. And the next point is to increase the collaboration among researchers. Okay, so for example, the researcher that already have their specimens stored in biobank. So after a while, there might be a researcher that requests for that specimens. So biobank staff will contact this previous PI of the specimens and ask them whether the other researcher can use the specimens or not. So from there henceforth, there might be a possibility that um, that there will be a collaboration if the both researchers shares the same area of research, same area of interest. So the next point that I want to discuss is to standardize. Why the importance why biobank is very important is to standardize the procedure, sample, and data quality, as well as integrity in a safe, secure, and controlled environment. So let me give an example. In U.S. National Cancer, they established Biobank, U.S. Biobank National Cancer, because they found out that um, their lack of standardized high quality specimens with their associated data can slow the progress of cancer research. Because of that, they develop SOPs for quality control for each specimen. And in year 2012, if I'm not mistaken. Okay, so by doing so, after that, they have the result that they after that they come out with the more high impact research due to the standardized of SOPs from each specimen. Right. So the next point is to ensure optimal utilization of samples and data for research. So for this point, so this is one of the example for the optimal utilization of samples. Okay, if you look at the left picture, okay, how I'm going to explain this? Okay, so we have several researchers that want to conduct research on this specific cancer. So all of them, they need to go to the hospitals and find their specific biospecimens. For instance, if you look at researcher B, she wants tissue and saliva for her projects. But how about the blood? If she takes the blood as well, and then researcher A and researcher C and D can use the blood from the same patient to their research. So if biobank involved here, if biobank help, the biobank will try to collect from each patient all the specimens, and then they will store in the biobank. So all the researchers, they can just go to the biobank and then ask the specimens that they needed. And then for your information, for blood, the biobank also process the blood and then process and turn it into several tubes of plasma or also pellets or serum. And then these several tubes of specimens, many researchers can use it for their research. So we can optimal the utilization of the specimens. So here, one sample for multiple research with biobank. Okay, so let's move on to the next slide. Alright, so I already talked and discussed about generally about biobank. So now let's go into the main topic, MH Biobank. So the background of MH Biobank, MH Biobank actually in the National Strategic Plan for Cancer Control Program for year 2016 until 2025. And because of this National Strategic Plan, Biobank unit was formed on 8 April 2019, and this unit located at IMR NIH Setia Alam to manage the MH Biobank in an organized and structured manner. And initially, MOH Biobank is actually focused on collected for cancer research. But now we are open to collect and store other diseases as well. Right, so MOH Biobank is a member of International Society for Biological and Environmental Repositories, or we short or call or short we call it ISBR. So this society is actually addresses the issues regarding scientific, technical, legal, and ethical relating to biobank and biorepositories. So main MOH biobank mainly referred to ISPER for the best practices all related with biobank and biobanking. Okay, the next point is that the aim of MOH Biobank is to accelerate biomedical research by providing high quality biospecimens and associated data. Okay, let's move on to the next slide. Okay, so what are the services that MOH Biobank provide? Okay, so I listed all the services that we have here. We provide sample collection, sample processing, sample storage, sample management, data management, clinical trial support, tissue microarray construction if any researchers want to do tissue microarray, and then we also provide service for project specific, and also provide consultancy and advisory service for all the researchers under MOH. If you look at the top right corner, okay, that is the example of the liquid nitrogen tank that we have here. This tank can store about 94,500 samples per tank. And then we also have minus 80C freezers. And then we also have minus 20C and then also chiller freezers to store samples. And then some reagents to do the lab work. So at the left corner of beside the liquid nitrogen tank, this is the lab, the biobank lab that we have here. So this place is to process all the samples that we receive from hospitals or other institutes, and then also to do all the like tissue microarray construction and all other related lab stuff. So, and then at the bottom right of the picture of my slide, sorry. So this is for the sample inventory. We use a software, an inventory software, that to make sure that our samples are managed in a systematic manner. And then for your information, for our freezers, we install each of our freezers with temperature monitoring systems. So this monitoring system, it can monitor our freezers 24/7. So if anything happen, we can act quickly and accordingly before major incident happened. Alright, so to researchers, if you have if you want help from us for any kind of these services that are listed here, you can contact us and we happily to help. Alright, so on the next slide, who and how, who have the access to use the biospecimen, and how are you going to use the biospecimens? So the biospecimens is available to MOH researchers, and then it is also available for non-MOH and industrial partners in research collaboration with NIH researchers or MOH clinicians. and the projects, you must obtain the MREC approval first. And then for request for MOH Biobank services and also the biospecimens, all must be evaluated and approved by the Biobank Scientific Committee first. And then lastly, the researchers, they need to acknowledge the MOH Biobank and also the MOH facility that provide the biospecimens in publication if they publish any related research project using the biospecimens. Alright, so let me explain elaborate a little bit about Biobank Scientific Committee. So this committee is actually their job is to review and also to give or to decide whether your application submitted to Biobank is approved or not. So they will make sure that your projects meets scientific and ethical standards before they give approve for using the biospecimens. So these are the members of the Biobank Scientific Committee. We have Director of Institute for Medical Research, and we also have Director of Clinical Research Center or representative, and we have Head of Pathology Services of Ministry of Health, and several surgical subspecialties of Ministry of Health, and we also have biomedical researchers, expert on biobanking, and public health specialists. And due sometimes we're going to invite another person, another expert or specialist, if that research that the application that you submitted is not in one of the members' specialties. Okay, so let's move on to the application process for request of biospecimens. Okay, so if the researchers want to use the biospecimen in MOH Biobank, firstly, you can email to us mohbiobank@moh.gov.my. You can inquire to check the availability of biospecimens. Right, so after Biobank reply to your email, you can apply the biospecimens that you needed, but you need to submit the biospecimen or data request form. You need to fill in the form. You can get the form from intranet NIH. This is for NIH staff. If you are not from NIH, you can just email us and ask for the forms that you needed to fill in. So after you fill in the form, you need to submit with a copy of MREC approval letter to MOH Biobank. So there are some that we need a material transfer agreement. This is especially for if you have a collaboration with non-MOH staff or industrial partners. Okay, so after that, the request will be reviewed by Biobank Scientific Committee, and then after about 7 days, you will have the request that you requested might be approved or might get rejection. So if you get rejection, the researcher can reapply back with a revised proposal that addresses the reviewer's concerns. So why you get rejections? Probably because insufficient justification for number of samples requested or lack of justification for the types of sample requested. So if your request got approved by the scientific committee, you can straight away arrange a date with MOH staff to collect the biospecimens from MOH Biobank. Alright, so these are our contact details. MOH Biobank. We located in IMR, Institute for Medical Research, NIH, in Setialam. And you can also give us a call by from this number, using this number. And then you can also email us, mohbiobank@moh.gov.my, and we will try to reply to you as fast as we can. Alright, so before I end my presentation, I would like to acknowledge Yang Bahagia Datuk TKPK for always give us support and acknowledge to MOH Biobank. And also I like to acknowledge Pengarah MR as well, and then to all the Biobank Scientific Committee, and also to the clinicians and other MOH staff indirectly and indirectly supporting the MOH Biobank, and also to my colleagues from Biobank unit. And then that's the end of my presentation. Thank you. Then I will pass back to Mr. Moderator.
Thank you, Alia, for providing us with a brief overview of the Ministry of Health Biobank and also highlighting the need for biobanking within the Ministry of Health. If there are any questions that you'd like to submit or ask about this presentation, please use the link provided in the YouTube channel. For the next second speaker, I would like to introduce Dr. Zhun. Dr. Lai is a medical officer who graduated from First Moscow State Medical University in Russia, after which he started serving in the Ministry of Health hospitals since 2013. He has worked in Hospital Umum Sarawak as a medical officer at the Department of ENT and Head and Neck Surgery for 5 years. Due to interest in biomedical research, he has moved on to a career at the National Institutes of Health and has been with the Ministry of Health Biobank for the past 2 years. He is the point person or the person in charge of the HKL or Hospital Kuala Lumpur IMR Biobanking project. Excuse me. It is our privilege to have Dr. Lai with us to share his experience with this project. Over to you, Dr. Lai. The screen is yours.
Thank you for the kind introduction, Mr. Moderator, Dr. Hans. Hi, good morning, everyone. I'm Dr. Lai. I'm a medical officer currently in the Institute of Medical Research, Biobank unit. First of all, I would like to thank IMR and also SEAMEO Med Network for giving me the opportunity to share a little about this HKL IMR collaborative biobanking project. Without further ado, I shall proceed with my presentation. So this is my presentation outline. I will start with a brief introduction. What are the project overview? Who are the parties involved? What are their roles and responsibilities? The workflow of the project. What are the challenges that we face and the improvements that we have made over time? The outcome and the acknowledgement. So HKL IMR Collaborative Biobanking Project. By HKL, it means Hospital Kuala Lumpur. IMR is the Institute for Medical Research. This is a pilot project. It's a joint effort between both IMR and HKL, involving a few parties from HKL, namely the pathology team, the surgical team, which is the breast and endocrine surgery team, and the colorectal surgery team, the Clinical Research Center of Hospital Kuala Lumpur, and the Biobank from IMR and IH. for this project, we are prospectively collecting breast and colorectal cancer tissue and blood from these patients. Uh, then, okay. So let me remind you, refresh your about this biobanking, what we do. This is a very important slide, the biobank overview. You can see from the left, this is the hospital. This will be Hospital Kuala Lumpur, where you have the patients, patients for in this case newly diagnosed with breast cancer or colorectal cancer, and their medical reports. And we would obtain their blood and tissue samples, which will undergo a de-identification process so that their private information will be secured. Subsequently, it will be processed. For this case, it will be processed in Hospital Kuala Lumpur itself in the clinical research center. The initial sample processing, the coding, and also the labeling of the samples, and temporarily stored in the ultra low temperature freezers, the negative 80-degree freezers, in CRC in Hospital Kuala Lumpur, which after a period of time, let's say 3 to 6 months, or when there are a moderate amount of samples, which we will arrange transportation for the samples and data to NIH Biobank, which is located about 30 kilometers from Hospital Kuala Lumpur. So for this project, there's some inclusion and exclusion criteria. The inclusion criteria being we are only collecting samples from Malaysian citizens, all primary breast cancer and primary colorectal cancer cases. They are newly diagnosed. Means if the patient is recurrent cases, they are not included. And also, most important, we collect the samples prior to any definitive treatment. But that doesn't mean that stage 4 cancers and such that requires chemotherapy is not included. We can still obtain their blood samples from patients who require neoadjuvant chemotherapy, but just prior to their treatment, we can obtain the blood samples. And the tissue we won't be obtaining because there will be the exclusion. It will be excluded. And of course, if we are unable to obtain any informed consent from the patient, we won't proceed with the project. So this is a picture of a Hospital Kuala Lumpur where I'm stationed there currently. Then I'll talk about the roles and responsibilities of the persons in charge. First and foremost, I'll talk about the surgeons and the clinicians. These are the staff that are working in the surgical department, the breast and colorectal cancer team. First, obviously, they are the surgeons who identify the patients. They are newly diagnosed. They will counsel the patients for their surgical treatment or chemotherapy treatment as such. Subsequently, once they identify that they fulfill the inclusion criteria, they may further obtain an informed consent for biobanking. This informed consent has two parts. One consists of about 5 pages of frequently asked questions and short answers. They are short, simple, and detailed answers, basically telling the patients and also maybe the medical staff what biobank is about. What is biobank? What samples do we collect? We must tell the patients that it doesn't affect their treatment outcome, whether or not they decide to join the project, and what kind of samples that we collect from them, namely blood samples and tissue samples, and etc. So, so for the first part they collect the blood, and also they fill up the biobanking checklist and the blood processing worksheet. This blood processing worksheet basically contains details like their names, their IC, and also their comorbids, their ethnicity, and whether any family history of cancer, minimal information. Subsequently, they will pass these blood samples and forms to the CRC team or the biobank personnel in this case for blood processing. This is the first part, which is the collection of blood samples. Okay, then the second part, which is the tissue samples. This they will proceed with their surgery. Usually, it might not be the same day. Take the blood taking tissue, the blood taking and the tissue taking will be a different day. They proceed the surgery as usual, but the difference is that when they fill up the pathology request form, there is a biobank stamp that indicates that for this patient, this case, it's for biobanking. This is to inform the pathology team to do further processing. Uh, So we have made these convenience packages, I call it, as packet A and packet B. Basically, packet A is for blood taking and consent taking. Packet B will be brought into the operating theatre. Whereas in the packet A, after you counsel the patient, after the patient agreed for biobanking, you take this packet A. Inside, they have 2 tubes, EDTA tubes. For blood collection, we need about 12 to 20 mils of blood in these 2 tubes. 2 blue-colored original consent forms, one to be given to the patient, one will be kept in the biomedical records, the blood processing sheet, and the biobank and the blood collection checklist. And this packet A, after it's filled up with your signatures and your information and the bloods, this packet will be passed to the CRC personnel or the biobank personnel for blood processing. Where the second part, packet B, will be brought into the operating theatre. Here you can see that there's a biobanking stamp. It's red color, so easily identify. It says for biobanking. You also state down the time when the tissue was taken out of the patient and to the time where the tissue was placed in the formalin solution. And it will be sent to the pathology team for further processing. So I'll talk about the roles and responsibility of the clinical research center and the biobank personnel in this case. I thank CRC HKL for providing us the facilities and the room and the space to process the blood and to store the samples. Basically, the CRC or the biobank personnel station in Hospital Kuala Lumpur will receive the blood, will process the blood in a centrifuge machine, label them, and store them temporarily in an ultra-low -80-degree freezer for temporary storage, and to store all relevant documents that are received in packet A. So this is a centrifuge machine in the clinical trial unit in Hospital Kuala Lumpur, and this is the first centrifuge process. You can see the blood is separated into plasma and all-cell pellet. So after centrifugation, after processing, the plasma and ACP are stored in 2 different micronic tubes. These are 2D barcoded 1.1 milliliter micronic tubes. White cap is for all cell pellet. Yellow cap are for plasma. This is an example of the micronic micronic tube rack. It can store up to 96 micronic tubes. And for each patient, we take around 6 to 10 micronic tubes. After the blood processing, it will be separated and filled up into these small tubes. So one small box, one small rack can hold up to 9 patients or as much as 16 patients. And this is a very small box. It's around 4 times 4 times 2.5 centimeter. So it doesn't occupy a lot of space if people are concerned whether it will take out a lot of their storage spaces in their -80-degree freezers. Okay, so the blood part I have explained. Now I'll talk about what goes on in the pathology team. The pathology team, they will process the specimen received from the surgical team. Basically, in this case, after colectomy or after mastectomy, they receive the breast and all collected tissue. They will process the sample as per usual for their diagnosis purposes. If there are remainder tissue, they will collect them for biobanking. It requires 1 block of tumor tissue and 1 block of normal tissue, which is usually around 10 millimeter away from the tumor or the diseased tissue. If, however, after the initial processing, the diagnostic measures that was done, if the tissue is inadequate, they will just stamp a biobank stamp which state that there's an inadequate tissue for biobanking. which is okay. Uh, Subsequently, each block of tumor and normal tissue they will also produce one H&E, hematoxylin and eosin stain slide. For quality control purposes, this will be done by the pathologist, the pathology team, using the histopathology assessment form. After that, they would store the blocks and slides and the forms in a prepared storage box prepared by the biobank team until the time to transport to NIH. So this is example of what we get from one patient. So from the left, you can see there's two cassettes, the tissue cassettes of the FFPE, and from the right, the H&E stain slides of one slide for each block. And the right side is a small part of the histopathology assessment form. Basically, they have details like for the tumor slide, what are the percentage of normal cells, percentage of tumor cells, percentage of necrosis and fibrosis. Then we'll talk about Biobank, what our role in this HKL IMR collaborative biobanking project. First, after discussion with the Biobank scientific committee team, we need to have meetings and discussion with the surgical teams, the pathology team, and the CRC team to coordinate the biobanking process from the clinics to the labs and to the biobank. We need to ensure the processes are run according to SOPs. Therefore, we have training and seminars to train the staff to assist in the collection and processing of blood. Subsequently, we arrange the transportation of the material, the blood and tissue, and the data, the forms from Hospital Kuala Lumpur to the biobank in NIH after a period of time, let's say 3 to 6 months, or depending on the amount of samples that have been accumulated. We ensure the samples and data are anonymized so that because we promise to the patients their private information are secured and will never be leaked to the general public or the researchers. We also perform quality control for the samples and data collected to ensure they are of the highest quality. So this is a general overview of the workflow between all departments. It summarizes basically whatever I told you so far about the HKL IMR collaborative project. You can see that 4 different colors. The top part, the blue color, is representing the surgical team. The first here, they identified and counseled the patient for biobanking and subsequently informed the staff in the CRC staff. And after collecting the bloods and filling up the forms required, they pass the blood. Basically, this is packet A. They pass this packet to the CRC personnel or biobank personnel to be processed. This purple this purple represents the CRC team. So this CRC team will, from the moment they receive the sample, they will process it, label it, store it temporarily in the CRC team. The whole process from the initial receiving of the blood up to the storage storage of the processed blood in the freezers takes about 45 minutes for one patient. If 2 patients, will be up to 1 hour 20 minutes, more or less, because the centrifuge can process up to two patients samples at a time. Okay, so this is for the blood part. This is the tissue collection part. The surgeons will provide the surgeons will do the surgery as needed, as usual, and fill up the forms using the form that have the biobank stamp, the red color stamp, to identify it as a biobank specimen. And after the pathology team receive the sample, they'll process as usual, prepare the blocks and the slides, and store it temporarily. Finally, after a period of time, the biobank will arrange transportation to collect these blood samples in the negative 80-degree freezers and also the blocks and slides from the pathology team and transport them to the MOH biobank in NIH in Setia Alam. Okay, I'll talk about the challenges that we have faced. Basically, this project actually initially was planned to start back in 2020. However, with the global pandemic of COVID-19, yeah, it has to be postponed and only started this year. And during the starting of the process, we have obviously we have some difficulty because basically the workflow of unfamiliarity, because it involves a few departments. There are many staff in each department. In the surgical team, we have the surgeons, the medical officers, the house officers, the nurses, and the medical assistants as such. Basically, they are relatively new to the concept of biobanking. Most of them actually never heard about a biobank. So we conducted seminars and training sessions and education and continuous education to the staff of the surgical team, the pathology team, and the CRC team, so that they are more familiar with the work, and so that the project can be done smoothly. Second, with the difficulty of obtaining informed consent, this is understandable because for the patients newly diagnosed with cancers, it is obviously a shock to them. They are more worried about their physical condition, their treatment plans, and such. And biobanking sometimes could be regarded as an additional information that might not that they are not concerned. For this, For this, I would say that it's better to time the timing of getting consent. It's better to get this consent after this definitive plan has been accepted by the patient. For example, obviously, if the patient is severely depressed or in hysteria upon learning the news about the newly diagnosed cancer, obviously you won't be counseling them for biobanking at this time. Maybe you give them 1 week during the next appointment when the patient have calmed down and finally decided for the next treatment plan. And after they have decided for surgery or chemotherapy, then as a further, you can counsel them for biobanking, because you assure the patients that for enrolling in this biobanking project, it does not affect their treatment and their outcome in any way. It is to help for future research. Second is manpower. Basically, we need the cooperation of everyone involved. Like I said, there's 4 parties: surgical team, clinical research center team, pathology team, and the biobanking team. There are more manpower. There are probably more communication issue. With time and patience and proper communications, it can be done. Finally, what are the outcome of this HKL IMR biobanking project? Basically, we have successfully initiated and fine-tuned the biobanking workflow in this HKL, in a government Ministry of Health hospital. We have accumulated a sizable amount of blood and tissue samples and biological data. Even though it's not significantly a lot, this is a stepping stone and model for expansion and formation of a biobanking network within the MOH. And finally, this is what we do. It's a contribution to research and society, which is the primary aim for Biobank, to facilitate biomedical research. I would like to acknowledge the IMR and HKL director, the surgical team, pathology team, CRC team, and the colleagues from our MOH Biobank. Thank you very much. I'll pass the screen back to our moderator.
Thank you, Dr. Lai, for the very insightful presentation and for sharing your experience in managing the IMR-HKL biobanking project. From your presentation, it's very clear that any biobanking effort within the Ministry of Health will not be successful if we do not have the collaboration, commitment, and dedication of relevant personnel at relevant stakeholders at all these hospitals, namely the surgical teams and the pathology team, as well as clinical research centers. We will now be moving on to the question and answer session. Please do not hesitate to send us your questions. I will try my best to convey your questions to the speakers. However, if we do run out of time, the speakers will try their best to answer your questions via email or another platform that the Secretariat will facilitate. So let's see whether we've got one here. Bear with me, I'm looking for whether we've got any questions. Right, so for the first question, I think this is for Dr. Lai. Uh, for the HKL project, did CRC process the blood samples, or was it the biobank itself?
Hi, thank you for the question. At the meantime, the CRC has been lack of staff. So for this first project, the pilot project, biobank personnel has been placed in the CRC in HKL to process the blood temporarily.
Right. So, just to elaborate further, I think for the just to elaborate further, I think for this pilot project, when we started out, when we mentioned it, it was pre-pandemic. We were supposed to start, but due to pandemic issues and all that, there is a lack of staff and manpower. So the biobank personnel, Dr. Lai himself, has been the one who's processing the blood at HKL. But we are trying to get the CRC personnel on board to facilitate and help out in the project. I think everyone needs to work together if this type of projects are going to be successful. Right. I've got another question from Engineering Research and Development Unit. Bear with me, the question's in Malay, I'll be translating it. If, I think this question will be for Puan, Alia. If a student from the university or educational institute needs samples for the project, for example, their master's or PhD projects, how do they apply for samples from the biobank? Alia?
All right, thank you, Dr. Hans. So, if the samples, so they are from the what again? From the Miss Pendidikan. Right.
Education.
So
Yeah.
education. Okay.
Yes.
So, our MH Biobank is actually for MOH staff, but if you are from Ministry of Education, one of the ways that you can collaborate with one of the MOH staff, and then this MOH staff can request the specimens that needed for you. Yeah.
I think just to add on, if a student from the university wants to access samples from the Ministry of Health Biobank, there are usually no issues. As long as the student, it is preferable if the student or the candidate has an MOH collaborator. But even barring that, the most important thing is they get MREC approval. And then this, if the person is from the outside, so Ministry of Education, they just need to email us. We'll provide them with the forms after they've gotten MREC approval, of course, and submit the forms for evaluation by the Biobank Scientific Committee, and we'll go from there. As I said, although I think Alia has already mentioned in her slide that we do provide samples for MOH and non-MOH researchers. But if it's non-MOH, we would prefer if there are MOH collaborators. If it is an MOH staff who's doing their postgraduate studies, that's fair enough. That's not an issue. But they have to get MREC approval, because at the end of the day, these patients are from Ministry of Health facilities. I think there was one minor edit in the Biobank Scientific Committee from Alia's one. It's the chair of the MREC is also part of the Biobank Scientific Committee, and she provides us with valuable insight into the ethical components of biobanking and research. So we're running out of time, but I think we will try to answer maybe one more question. Okay, so I've got a question I think I'll just answer this. How long does the approval process take? I think in simple terms, it all depends on the completeness of the documents. Okay, so if everything is all good, no lacking documents, it will be vetted by the Biobank unit first, and then we'll pass it on to the Biobank Scientific Committee chair. And if there are no issues, if it's a simple, straightforward request within MOH, it takes about 14 working days. If it involves external parties and it's there are more complicated issues such as samples going elsewhere, or if the proposal is unclear, for example, if if a researcher requests for samples, but they just say, we need 100 samples of blood from breast cancer patients, but they don't specify what do they want to do with the blood, or what exactly do they want, then there's not enough detail. Sometimes these sort of proposals may pass through their own ethical committees or even MREC, but since we want to optimize usage and utility of all these samples, it is very important that the researchers are very specific with what they want and what do they want to do with them. That is what this is the main reason why things are delayed, because the proposals are not detailed enough, or the documentation is not complete. So, short answer: as long as it's complete, 14 working days. If it is incomplete, it can go on until it's complete. I think that's all the time. I've got the nod from the secretariat. That's all the time we have for questions today. As I mentioned before, we will try to answer all the posted questions. There's about lots of questions. We will try to answer them via email. And we hope that this webinar has provided some insight into the biobanking activities being carried out by the Ministry of Health. And feel free to contact the MH Biobank if you have any other queries or interests in collaborating. So, ladies and gentlemen, we have now come to the end of the webinar session. I would like to thank all the participants for their support and the Secretariat for making this happen. You may subscribe to our National Institutes of Health Malaysia YouTube channel. Click for notifications whenever there's a new post. And before I conclude, I'd like to announce that we will be having another webinar session on the 2nd of December, the topic of which is whole genome sequencing analysis for comparative investigation of bacteria genome diversity. So do mark your calendars, and we hope you can join us for the next session. Until then, many thanks from all of us at IMR, and forgive us if we have made some errors. There were minor errors here and there, but we are all human after all. So take care and stay safe. Have a good weekend.